Well. Welcome to Pamli Vlogs, and I'm live today. I would like you to join me. I'm still doing some setups, and you will join me as we'll discuss everything to do with Pamli Vlogs and what I do in YouTube. So, one of my cameras is not clear, but you'll bear with me. Uh, the, this one is my laptop camera, the one I've removed, and the one I've added is the laptop camera. It's not very clear, so it is the admin. So I want you people to join me, and let's make this day very successful. Thank you so much to those who have joined, and you can share. I'm still doing some setup so that we can start discussing this day very well. We want to do it until we will be tired. So you may bear with me as I do some setup so that everything can look professional. If you joined us, kindly share with people because it will be very vital for us to share with very many people. You can also comment. There's a streaming link that I posted there, and with this streaming link, you can join and help us in this discussion. I cannot do this alone, and I may do it if you people have assisted me in doing this. So I'm doing some setups, and I'm happy that those who have been supporting this channel are still supporting us in terms of sharing videos and even commenting and even welcoming our new friends. So I would like you people to tell me whether I'm very clear enough, whether there's some echo or not. I'm just trying to set the thumbnail so that it can appear more professional, so that people can click it and join me in this live blog. So thank you so much. And those who have joined, you can share the link so that the discussion to be very lively. And the thumbnail is set. And I'm very happy that now we can continue to start this. The only thing that I need to do is to pin for you the StreamYard link. So StreamYard link is very important, and because this is the link that you people will use to join. I just want you people to join me, and the StreamYard link is available there, and you can click it, and I will invite you on the screen. And if you come to the screen, I will be so happy. So, guys, this is very vital for us. And in terms of comments, you can also put your comment there. That is what I've pasted there. That is a YouTube link. And also, I'm looking for what we call the StreamYard link so that I can send it into group. So I'm pasting the StreamYard link in the comment section. StreamYard link, I'm pasting the StreamYard link in the comment section so that you can click that link and come to the screen. The screen is available for you. As you can see, I've removed one. and I can also add another one. So if you come, I will invite you, and we will start the discussion. I want somebody to manage this for me as I do some setups, because with StreamYard, if you are working alone, it might be very, very difficult. You need to do some setups, and if you've done these setups, somebody can join you online and help you to manage your channel. And I'm very happy that most of you have been supporting me very nicely, and they have been joining me in the discussion. And with this, we see the topic, the title is Road to 4,000 Hours. We want to achieve that. Uh, we want to achieve that. Just pasting this. Join me. Join me live. Join me live. Yes. So that you guys can come. So remember, if you want to join me live, there should be no background music, because we don't want to get strike. Don't want to get strike. If you get more than 3 strikes, then YouTube can take your channel down. So guys, I'm welcoming new YouTubers and new people to the channel, and also I want you guys to be with me, and we want to recheck what we've been doing for the past 2 weeks, and also checking the videos that we've been posting. And even you can ask at the comment section. You can ask any question that you feel is very, very vital to you, and I'll be very, very happy if at all you join me in this particular discussion of today. So guys, I'm still welcoming people here. Join me live. It's very, very quite cumbersome, but we are used to it. So it's a group I'm looking at here, our normal group of Kenyan YouTubers. Sometimes they may not be aware that I'm live. So I'm looking for them so that we may kick this particular discussion. So join me. Okay. Yeah, I love these guys because they are always with us. They're always with us. They're always with us. They're always with us. Yeah. So everything is set. Everything is set. Everything has been set. So this one we can put somewhere here. So welcome to Pamli Vlogs again, and today I'm very, very happy to put this very nice way where we are putting there every day, every day, every day. Okay, this is it. This is it. I'm in the hostel, so today I'm just off duty, and Ethernet that is here is giving us good internet, so we can just vlog the whole day. So my people, welcome to Pamli Vlogs, and I'm very, very grateful for your support and everything that you've been doing to this particular channel. And today we just want to hammer it by discussing everything to do with Pamli blog. So I've just put that is join Pamli blogs. It's a medical chat, or you can do anything. You can ask me anything, and I will be very very happy in terms of this. So let me just do my normal setup, and I will join you shortly. I will join you shortly, and we are going to review very many things. This is road to 4,000 hours. So I'm just checking whether things are alright. Is my sound good? Am I able to? Am I audible? Anybody who is watching? Okay, let me test. Going on where? Is echo interfering with you people? Okay. Let me go and visit it. If echo is interfering, then I will have to leave one. You have to leave one channel. So let me just go and check it somewhere if at all it's good. So joining you shortly. Stay put. Stay put and joining you very, very shortly. So guys, we are still doing the setups, and I would like you people to kindly stay put and continue watching this channel. And we are going to discuss very many things as soon as I'm through with the settings, and we are going to discuss very many issues affecting our lives in terms of diseases. So don't go away. Stay put. I'm still doing some setups. Yeah, coming. Well. We are still doing the setup. Doing Yes, we are still doing the setup. We are almost through. Uh, yes, Nico C, but off duty. Yes, mtu analia. I'm in the hospital, but I'm off duty. So crying is expected. So guys, there's something that I'm still going to do here for some few minutes so that we can start it very, very well. So I'm waiting for people to come and join. If you do not want to watch, you can leave it play in the background, and it's very, very vital for us. So, guys, uh, welcome to Pamli Vlogs, and today we are very happy that we are doing it. And as we are still doing setups, kindly stay with me. Do not go away until we will do it. We want to be like the other time. Last time we went for 6 good hours. So kindly stay put as I continue doing this. Welcome to Family Blogs, and this is very, very vital for us as YouTubers. Kindly stay put, do not go away. Well. Now I'm back full blast, and waiting for people to come and join me so that we can start it at a very high rate. So, guys, this is Pamli Vlogs, and welcome. We want this chat to go for quite some time. So, people, you are invited. Okay, let me check something here. It's very vital. Mm. Yes, my friends, click the StreamYard link and join me so that we can do it. Well. Yeah, welcome to Pamli Vlogs, and we are still doing it. And this is a super Sato challenge. Let me see. Okay, let's do that. I'm seeing two people online. You can put this one in the background if at all you do not want to watch. Okay, you can subscribe to our channel by clicking the link that is provided. And if you are online, also you can click the StreamYard link that is provided so that you join this our channel. Uh, we are doing well. I need more people to join me. So this is it. Okay, you can ask questions. This is wonderful. This is very vital for this channel. And if you have not subscribed to this channel, kindly hit the notification bell and subscribe so that we can do it. So I have some things there that I need to share with you, and it is very vital so that I can start. We wanted to discuss something that I wanted to share with you here in terms of YouTube and what we do. So being a YouTuber is very nice. It equips you with knowledge and because every time as a YouTuber, if you want to present, you must do a research about what you want to present so that you present something which is very, very vital and very, very important. And in this particular research, if you do it well, your viewers will be very, very happy. So, guys, there's no much that going to say here, but I wanted people to join and we start discussing. So, if you want to join us, you can join us and you can say something. You can say something here. Okay. Okay. Expand this. Yes, buddy. Expand this. I want to line keyboard. So, most of my videos revolve around gynecological, sometimes obstetrics, sometimes I cover reproductive health in general, involving both women and men. And if you are a keen watcher on my channel, I've discussed most of the commonly common conditions that normally affect individuals. So I also have been doing series in this particular book. I have season 1, season 2, season 3, and season 4. So the series that I've been doing, kindly watch those videos if you've never watched any, because they are very, very important in terms of antenatal care and care of the mother and the child during pregnancy, even the antenatal profiles, and more so a very important one called father support. So if you have not watched those my videos, kindly please do watch them because they are very, very important in the community. And I would like to tell you that videos, the last video, the second last video that I dropped about human papilloma virus, we are advocating for 10 years old children, 10 years old children, particularly ladies, 10 years old girls, to come to any government facility to be vaccinated against human papilloma virus. We know that HPV will manifest later when somebody is sexually active, and bigger percentage do get HPV, and they remain dormant into your body until their body immune system will be weakened. Is when now they start manifesting. And I said that it can take from 5 years, from 10 years, even 20 years for it to manifest. So if at all you've not watched that video of human papilloma virus, kindly watch that video. It's very, very important. And I would like to tell you that that video is supposed to be shared. Kindly share that video. Kindly share that video so that people may watch it. Share that video so that people may watch it. If you don't share, people will not get that knowledge. There are very many people who do not know that that particular vaccine do exist. And the only way you can know that this vaccine exists is by sharing this particular video to people. And if people watch it, they will love to bring their children for vaccination, the girl child 10 years and below. And also talked about other conditions that may result in human papilloma virus. I talked about plantar warts, the genital warts, and these warts also can be very scary. Even the common ones, the ones normally affecting the face, skin, they are very, very vital so that they can be treated. So if you watch that video, and if you have not watched that video, kindly log into Pamli Vlogs or Google Pamli Vlogs. I'm available, and you will watch it and kindly share. Many people normally ask about common conditions. Yesterday, I posted a video on ectopic pregnancy. Ectopic pregnancy. We normally don't fail to get that. Every week, we must get 2 or 3, either ruptured or not ruptured ectopic pregnancy. I discussed very many points that are tied to ectopic pregnancy. I also talked about causes of ectopic pregnancy and the risk factors that might be tied to causes of ectopic pregnancy. I mentioned pelvic inflammatory disease, and I encourage all ladies that if you feel abdominal pain and loss of amenorrhea, that is loss of menses, and you see you are bleeding from the vagina, it might be ectopic pregnancy. We think of ectopic pregnancy first, even before we think of abortions or miscarriage. So kindly come to the hospital, and we will do the necessary tests. We'll do transvaginal ultrasound or obstetric ultrasound. We'll monitor your beta HCG levels. We can even monitor your progesterone levels to verify whether they are normal or not. Of course, if you do not want to go to surgery, we may give you methotrexate only if the ectopic pregnancy is not ruptured. But if it is ruptured, it will just, it is an emergency that is now gynecological, obstetric gynecological emergency that may warrant you to go for a surgical intervention. And of course, we will be monitoring you post-surgery to see whether you are well. And this is so nice, and that is a video that was nice. I want to share this, my link, so that people can come and we discuss a lot. We discuss through our WhatsApp groups that we normally invite people to help us chat along. So it's a very, very happy Saturday, and this is a Super Sato. You can play it in background, or if you don't want to play it in background, you can just subscribe to this our channel, and also there's a StreamYard link that is provided there. You can join it, and you be part of the community that is supporting Pamli Vlogs in terms of watching our videos and sharing our videos. And also, if you have a question, you can ask, because this is what we do. This is what we help people with. This is what we normally do in terms of cases. So guys, just want to welcome others. This laptop is not typing. I want to welcome others so that they join me in this discussion. So it is very, very important to note that females do have very many issues surrounding them, and that is why we take our time to vlog. I hope I'm very, very clear. I hope my my voice is audible. Let me try. Okay. 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 Don't want the echo. So kindly, guys, join me in this, and I will really appreciate what you people have been doing in terms of supporting this channel. And I'm very happy for those who are constantly supporting us in terms of what we do in this our channel. So guys, continue watching, continue viewing, and I'll be very, very happy to be with you so that this chat will be a very, very important one. Okay. So you can also comment, you can also join us through StreamYard. You can also do everything that you need to do to keep this uh, vlog awake. So guys, I'm very happy for what you people have been doing. I'm very happy for those who have been supporting this channel, and I want just to review some of the videos that I've done. I had around almost 30 videos that I was to make in the year 2020. I had managed to make some, but some were not commonly common conditions. So the videos that I made, I've encouraged people to watch, and mostly I do medical videos and weight loss solutions, and these particular videos are helping our community, Pamli blogs. There is a video I made on Helicobacter pylori, and most of people watch it, and I've gained several advice in terms of people appreciating and letting me to advance this channel, and I'm very happy that I normally do that. And in that video, Helicobacter pylori, we talked of very many things, and I said that it's a number one cause of peptic ulcer disease, apart from non-steroidal anti-inflammatory drugs, the likes of brufen, diclofenac, indomethacin. I told people to kindly avoid those drugs. If you feel that you are suffering from ulcers, you can use ordinary paracetamol. And Helicobacter pylori test is being done in this our facility. And if you diagnose you, of course, we'll put the patient into what we call triple therapy. They are drugs that you will take for at least 14 days, so that we eliminate this Helicobacter pylori. And you can get it through a fecal oral route, anything you eat via food. That's why we encourage each and everyone to drink boiled water, to drink treated water, even wash fruits before you consume, because you can get Helicobacter pylori anytime. And also we talked about risk factors like smoking, drinking alcohol, eating spicy food can do that. So it's a video that I would like you people to go and watch, and I would like you people not to miss it. I talked about infertility in women. Some perusing through my book, I just inform you of what I did. Infertility in women, we talked about possible causes like hormonal imbalance can cause that. We talk of the pelvic disorders like uterine fibroids, endometriosis, adenomyosis, cervical polyps, and even things that normally interfere with the fallopian tube, like pelvic inflammatory diseases can cause inflammations at the fallopian tube, causing scar tissues, and even smoking that also interferes with the cilia, and this one can even cause ectopic pregnancy that I talked about, or even can cause infertility. Of course, I talked about primary infertility and secondary infertility, and I said that primary infertility, these are couples that have been trying to get a child, but they have not, for a period of 1 year, sex 3 to 4 times per week, no use of contraceptives, and there is no child for a period of 1 year, then that is primary infertility. Of course, we also talked about secondary infertility, that normally involve people who have had a child before, but now they are not able uh, to conceive. And I talked about even how we can help them to overcome this. I normally have appointments with clients suffering from this particular problem. We normally cancel them and then we refer them to, mostly I do my referral to MedHeal. It's a fertility clinic there. And they normally come with a very, very positive report. So that one was to do with infertility. Infertility in men, of course, I've talked about that. And in that, my discussion, it was a live discussion and it was so long. I talked of possible causes infertility in men, ranging from problems affecting your testes, problems affecting the sperm production, problems affecting the development of sperm, the genetical disorders, and the need to take a step. The only problem that we normally face as clinicians is that some patients normally come alone. They normally come alone. You know, we can't discuss infertility. We can't discuss infertility with you alone, particularly when you are married. Hmm? Are you hearing me? Yeah, we can't discuss infertility alone. So if you suspect that you met the criteria of definition of infertility, kindly do not come alone to the hospital. Please come with your spouse. Come with your spouse. I normally get a woman coming because mostly women are the one who are mostly disturbed. They come alone, and I do counsel them. Of course, I give them an overview of what could have caused that infertility, and maybe secondary or primary. And I do advise them, the married ones, that kindly come with your husband. Try to convince your husband to come to the facility so that we can discuss a lot with this particular patient, because there are some several tests that you cannot do. You cannot make a conclusion as a medic alone. Like if a female comes, there are several tests that I can do to this particular female, and there are several tests that I can do to a particular male, so that we come into conclusion. And also, sometimes every test we've done pelvic ultrasound, we've done urinalysis, we've done even X-ray of the tubes, and every test we've even referred for hormonal levels. Everything is normal. In my video, I've talked about a known cause of infertility. And this is now where we say that God's time is the best. Add with prayers, and everything will be okay. So sometimes it is very, very demoralizing and killing somebody's morale that they have done all the necessary tests and everything is negative. Everything is normal, not even negative. Everything is normal. So they ask you, Daktari, now what next? Yeah, we face several of cases of that, and some normally take their time because ovulation is very, very mandatory and it is very, very key. And timing it is also very, very, very important. Sometimes somebody is not timing this ovulation, and you find that um, patient or the woman works away, husband works away, they meet, every time they meet, ovulation has occurred, and there is no child. 1 year is going plus. So I normally tell them, if it is work, find a way of getting even 1 month day off, visit your spouse where she's working and start working things out. You will find that maybe it was because of ovulation. And in that month, the woman conceived, and we thank God for that. So videos that I normally make also is weight loss solutions. Talked about very many things about weight loss solutions, and I would like you people to watch those videos like the cucumber juice, the green tea video, the apple cider vinegar video. I like apple cider vinegar because it burns fats even when I was doing a lot of vigorous exercise. So if you have not watched apple cider vinegar video on how to prepare apple cider vinegar video, mine, kindly
Watch
watch
that
that
particular
particular
video
video
because
because
it's
it's
very,
very,
very
very
important
important
to
to
burn
burn
your
your
belly
belly
fat
fat
because
because
we
we
do
do
not
not
want
want
you
you
to
to
face
face other medical conditions like diabetes. Yes,
oh
welcome.
iti one
Eh,
tarehe ile yeka
yeah, yeah.
poki chako
No, it's on.
oh
Just come.
ile yana wewe ngombe tarehe
Oh. Yes, that's my friend and a colleague. They're at work. This office is free for us, so we just vlog, family vlogs. Subscribe to this channel for more videos that we post. Let me find out what that my colleague wants, and I will join you shortly. Let me find out what that my colleague is doing. Let me just mute the. Let me mute this particular Let's continue. Let's continue with the discussion. Um, thank you so much. I've been continuing with doing this. Hello, where is everybody? Accord. Everybody's lost. Welcome to Family Vlogs, and I've been trying to invite people, but today maybe they are still in church. Uh, they are still in church. I would like them to come aboard and we continue discussing. I've been trying to wait for the quorum. The quorum is not going on well here. The quorum is not going on well here. And I'm happy for the five people who have been with me. Yes. Oh, can you come in and talk medicine? Mark, come in and talk medicine. Subscribe to Family Vlogs for more videos that we always post. Turn on the notification bell, and always share each and every video you watch, because it is very important. We are in road to 4,000 hours watch time, and as I've told you that this is my month of monetization. So everybody's welcomed. If you want to join the screen, there's a StreamYard link. There's a StreamYard link here. There's a StreamYard link that is available, and if you click that StreamYard link, you will join the discussion, and I will put you on the screen. Let me test. I hope I'm audible. Okay, that's good. If you click that StreamYard link, it will bring you to the screen, and we'll discuss, and we will continue discussing the way it used to be. So guys, I'm happy that we are doing 1 hour strong, though people are still not there. The channel is still very small, so we don't have many guys to join us online. And sometimes I do leave. I was not consistent in here. And kindly, guys, this live blog, before I leave it to be silent, I would like you people to come on aboard and let's chat. Now, YouTube is very important, because let's do it. Vikuja tu nitakukaribisha. If you come in, click the StreamYard link, you will yes, thank you so much, because I was sending something to you've been very vital to this my channel, and I would like to tell you that I want us to discuss a case here that is bringing waves, and I had prepared for it, and perhaps this one will be very vital in this today discussion, and it's to do with men. We want to discuss what we call benign prostate hypertrophy. Benign prostate hypertrophy. benign prostate hypertrophy. I don't know whether this one is benign prostate hypertrophy, enlargement of prostate gland, and in this discussion, I want us to talk of some things: benign prostate hypertrophy. Now, BPH or benign prostate hypertrophy or hyperplasia is a condition whereby the prostate of a male, it's only male we are talking about, gets enlarged, and it can present with some signs and symptoms that we may be irritating to an individual. And this is normally non-cancerous. Only few become cancerous, but mostly cancerous, and is affecting around 105 million people globally, attacking, mostly affecting those who are 40 years and above. And it doesn't risk people to have prostate cancer. It doesn't risk people to have prostate cancer. But if you present with a swollen or an enlarged prostate, of course, we will do some tests to elicit or to tell us whether you have, is it related to cancer or not. Now, hormonal imbalance normally causes this, and in men, and we call this dihydrotestosterone, DHT, dihydrotestosterone, DHT, is a mediator of prostatic growth, and in this hormone DHT, when it is interfered with, it can cause a development and enlargement of prostate glands, and also an enzyme reductase also play a role in this. Also, diet is also a major cause, and this is due to a research that was done in Japan, and it was proved that those who normally take a lot of proteins, men, they tend to develop enlarged prostate gland. Also, it is normally tied to age. When you are aging, the prostate normally develop what we call fibrosis, and it starts to weaken in its muscles and start to enlarge, and this plays a role in enlargement of prostate glands. Now, how will this particular patient present? How will this particular patient present? We have what we call International Prostate Score Symptom Score, and this is a score that we put an acronym of FUNWISE. FUNWISE. So this acronym of FUNWISE is helping us to gauge how is this prostate enlargement disturbing this our particular patient? How is it related to the life of this our patient? So FUNWISE is the acronym we normally use, and the word F from the word FUNWISE stand for the word frequency of passing urine. So we will ask, over the past month, how often have you had to urinate again less than 2 hours after you have finished urinating? You know, there is increased frequency when somebody has benign prostate hyperplasia, and that frequency, most of the patient normally present with that. Now, in terms of the U, what is the agency of passing urine over the past month? How often have you found it difficult to postpone urination? You know, urination sometimes, if the bladder is full, it's very hard to postpone, and mostly come with pain on the lower abdomen, with swollen bladder. The bladder is enlarged with urine because they can't pass that particular urine. So U is for urgency. And we go to number 3, which is N. N stands for nocturia, at night. what normally happens to you at night. And we ask, over the past month, how many times did you mostly typically get up each night to urinate from the time you went to bed until the time you got up into the morning? So that is from the fun ones. The acronym N stands for Nocte. And also W, which is number 4, stands for weak stream. Weak stream, weak stream. A weak stream over the last month. How often have you had a weak urinary stream? You want to pass urine, but it is very, very weak. It is passing through the penis when it's very, very weak. We ask you that question to do with uh, weakness of the stream in terms of urination. Intermittency, that is the acronym I. Over the past month, how often have you found you stopped and started again several times when you urinated? So that is, we asked about that. S stand for straining. Straining, when the prostate is, and when the prostate gland is enlarging, there's a difficulty on urine passing out through the urethra because it's normally presses that part, and there is straining. Over the past month, how often have you had to push or strain to begin urination? So we ask that, and that is very, very vital in terms of benign prostate hyperplasia. So and then E stand for incomplete emptying. E is emptying. Over the past month, how often have you had a sensation of not emptying your bladder completely after you finish urinating? So and then lastly, we have quality of life due to urinary symptoms. How are you visualizing this in terms of urination? If you were to spend the rest of your life with your urinary condition just the way it is now, how would you feel about that? So there's a way we ask that, and we tell them, will you be delighted? Will you be pleased? Delighted is 0. No, there's nobody who can be delighted when he has a condition that's stopping him from using, or he cannot, or he has a weak stream, or he cannot control the frequency and urgency. So when he's pleased, score 1, mostly satisfied 2, makes 3, mostly unhappy. The scores normally starts from 4 to 5, which is unhappy, and mostly they tend to answer 6. It is very, very terrible. It's very, very terrible. So benign prostate hyperplasia uh, is is a condition that will affect males of 40 years and above. The prostate glands enlarges, and there is no way the patient can pass a urine. So when you have this particular condition, it's very, very difficult for you to score 0. You cannot be delighted with this your condition. No. So in short, that is how we score. So patients will come with increased frequency of urination, urgency to urinate, excessive urination at night, intimate leaking or during urination, and straining on urination, emptying, incomplete emptying of the bladder, and even mostly do come when they have urine retention. Urine retention. So how will we diagnose benign prostate hyperplasia? How will we diagnose benign prostate hyperplasia? Diagnosis will be based on history and physical exam. And history and physical exams will be looking at the International Prostatic Symptom Score, that is IPSS, and we will get them and score them when we core 0 to 7, that is mildly symptomatic, 8 to 19 moderately symptomatic, and 20 to 35 severely symptomatic, according to how they will score in this particular uh, sheet. And again, physical exams, we might find that the bladder is enlarged, and even in digital rectal exam, it will be telling you the procedure. You lie down, and we, with our gloves, sterile gloves, we go into your anus, and then we feel for the prostate. We can feel a nodular or lumpy the prostate with um, very this the surface may be indurated, not even smooth. Now, management of this particular patient is, oh, before we go to management, we can also do what we call prostate specific antigen test, and they normally come in terms of nanograms. That the acronym we give there is PSA. PSA, when it is safe, that is 0.25 nanograms. Safe for most is 2.6 to 4 nanograms per mil. Suspicious 4 to 10, and dangerous is 10 nanogram and above. When PSA is elevated, we can think of cancer of the prostate gland. Of course, we'll also send the patient for prostatic ultrasound, and this one will reveal to us that prostate is ideally enlarged, and they will also tell us even the size of the prostate. Now, management is active surveillance. When we are doing management, management can be tied to investigations that we normally do. You can even do for facilities that can do what we call urine outflow rate. Urine flow rate, we can do that, and the prostatic size, that what I've mentioned, prostatic imaging, that is cytoscopy, and TRUS, that is transurethral ultrasound, transrectal ultrasound, and tested questionnaires that I've talked about. So management is normally depending that, and we can also uh, manage this by drugs. There's some specific drugs that we prescribe for this condition. And when this condition is bothersome, we prescribe drugs for a period of time, and there is no change. We can opt for what we call prostatectomy, that is surgical removal of prostate gland. And it is very, very vital, and it normally helps to cure now this particular problem. Yes, that is all about. My friend has asked me something here. One of the things, hello, Pamli, Gram Free Pay, I don't know why, please, all German members, not good. Oh, I think I talked about this issue as time about Gram Free. Gram Free is an online business, and they deal with cryptocurrencies and advertisements. And I've made almost 3 videos about Gram Free because I also do some bit of online business. Now, for Gram Free not to pay you, first of all, you might read terms and conditions, whether they are paying your country or not. Kindly go back to terms and conditions. Perhaps they are not dealing with all people in Germany the way you are saying. There are some countries that even if you do, they won't pay. But Kenya, they pay USSR, some countries like India, they pay, America, they pay, Kenya, they pay, Uganda, Tanzania. Tanzania, I'm not so sure. So also when you make your account, fake accounts, they will detect, because if that Gmail is only made for your account, for you to get grams, sometimes they may not pay you. When you have fake referrals, they will not pay you. That means you are cheating. So there are very many reasons why grams cannot pay you, because nowadays they even disable the customer care link that you can ask questions. So my friend, it's very, very difficult for me to highly say why they have not paid all the Germans. I don't have a very genuine reasons, and I say that payments normally take up to 6 months. So if yours is past 6 months, I don't think you will be paid. I don't think you'll be paid. So kindly check that. So it's around, what is it, around 14:35 for this my, oh, okay, we vlog this for an hour. Okay. So guys, those who are watching this live stream, please subscribe to my channel, turn on the notification bell for more videos that we'll post, and also like and share this vlog because it's very, very important to us as the community of family vlogs. So I wanted this to go for hours. So I'm seeing 3 are watching. I'm waiting for you to ask questions. Okay. Questions, ask questions, so that the discussions can be very, very lively. Let me face you through this. Yes, this camera is Well. Thank you so much, those who have been patient. And I was doing some setup here that I'm now through with. And we were discussing something very important. And it is very, very vital that now you are with me and I can remove this one. For those who have been joined me, thank you so much. Sharifa Nakalema, how are you, my dear? Welcome to the vlog. You can play me via background. Um, I've been discussing what we call benign prostate hypertrophy, that is enlargement of prostate gland in men, and I've just cleared that discussion. Um, I want to move to the next topic, and for those who have arrived here, thank you so much, and you can share. Yeah, well. Welcome to Pamli Vlogs, and I was a bit busy, and the setting up was taking half of my time. So thank you so much for being patient, and uh, Mwakazis, tujambo. Thank you so much, Mwakazi, for this. Mwakazi, hello, Mwakazi. Niko sawa, niko salama. Sherifa na Kalema, I'm very fine, and the setting of this StreamYard was taking me a lot of time, but this is what I want you people to do. Kindly join me via this my StreamYard, and let's go. And if you cannot play, if you cannot watch, you can just put it via background in terms of supporting Pamli, and I will really appreciate. Um, it is long, and I would like to welcome you all. Welcome, welcome. It was taking years. So I'm welcoming you all. I don't know how visible I am. I don't know whether I'm very cool. I don't know whether the stream is not as smooth as. Oh, Mwakazis and Asumbi, welcome, my friend. Let me pin you on the screen. Thank you so much for joining. Am I clear? Am I audible? Are you able to hear me well? Or my voice is not good? Let me try. Okay. Are we okay? Is the voice okay? Or is it streaming well? Because your presence here is very, very vital to me. And if you support me in this my channel, and you know the journey, the journey is here. You can even play it in the background, and you support that my journey. So kindly, this is what I'm doing. Kindly support me. I'm seeing Sherifa Nakalema, Subi TV, the Mokalis. Thank you so much for joining this, and you can either watch me or play me background. And also, you may share the vlog to the other group. You want just to leave it playing. I'm seeing 3 people are watching, and I'm very happy for the 3 guys that are there. Simply leave it by background as I do some settings so that you can join me. Let me just mute this, and I'm coming back. Okay, I have a guest. Yes, Dinas.
Mambo bana. How are you doing?
Hey, how are you?
Niko poa sana sana sana.
You're fine. Let me ongeza hii volume nikusikie kiasi.
Yeah, yeah.
Hey, how is town?
Town is very fine. I have a friend
Okay.
of yours. I have a friend of yours here. You remember
Huh?
that face?
Hello?
You remember that face?
Okay. Oh yeah. I remember. Are you from work? It is already three o'clock.
I'm just leaving work right now.
Oh, you are leaving work right now.
Yeah, yeah, yeah.
Hey, Mazee, me pia I'm traveling. As per yesterday, I'm remaining with 554 hours.
Uh, that is very achievable. You can do it.
Yeah, I'm saying this month
Mhm.
I'm trying so that before the end of this month I'm through.
I know you are going to make it.
Uh,
If people like us made it, why can't you make it?
yes. I love that.
I'm just wishing you all the best, bro.
Why is that? Ay, ay,
Mm.
msalamie sana.
Huyu jamaa ako sawa huyu.
Okay. I'm also okay. I'm just trying to stream. I checked yesterday; it was 554. Though today they have not updated.
Mhm.
I think they will update it maybe with the course of the day so that I see.
This is the month.
This is my month. In fact, hii mwezi haitapita.
Yeah, yeah, yeah.
Those 554 hours,
Mhm.
I must click.
Yeah, you have to do it. You have to do it.
Yeah.
When you make it, it's also a celebration.
Uh,
You also celebrate because your win is our win.
yeah, that's why nowadays I post after every 2 days. I post a
Yeah.
video. Even tomorrow, I'm supposed to be posting another one. I just want to clear this stream and start preparing for tomorrow's
Mhm. That's good.
stuff. Oh.
Yeah, otherwise, any other business?
Mm. Yeah, I'm
Sasa, let me
seeing
go.
it. I've not
Let me
seen
go.
in the screen nowadays. What happened?
Oh, this guy.
Okay.
Corona happened. Now it's just back from the pandemic.
Okay, by the way. Mm.
So let me run
Hiyo
you in
ni
the
mzuri
background.
sana. Oh, unasema you will be in Kisumu tomorrow, eh?
Yeah, I'll be in Kisumu tomorrow. I want to go and do some 1, 2, 3.
Okay.
Uh,
Usalamie Brayo Mfalme ukifika huko and those YouTubers wenye wako Kisumu.
Sawa, bro.
Okay.
So for the time being,
Okay.
let me run you in the background as I go to the market. I'll join you again later.
Thank you so much. Thank you so much. I will really appreciate.
Sawa, bro.
Haya, karibu.
Okay.
Thank you so much. Okay, that was Dinasi Lawrence, Dinasi from Asumbi TV, a very good friend of mine, normally giving me encouragement via YouTube. He's in Kisii town. I love him for this. Mm. Kindly check his channel, Asumbi TV, Dinasi Lawrence, and Dinasi. Asumbi TV is dealing with comedies of Luo comedy, and some jokes. Some are in English, some are in Luo. It's a very nice one. Then Dinasi Lawrence and Dinasi family posting current issues happening to Kenya. So check that channel. I love him because he's a guy who is always helping and always encouraging people to uh, do well YouTube. Thank you so much, Dinasi. And we are still waiting for any guest, that can join us. We will put you on the screen, and we'll continue doing this. If you want to come to the stream, in that my uh, video, this is my video that I'm doing live. There's a streamline link. There's a StreamYard link there. Sorry for that. Sorry for that echo. There's a StreamYard link. If you click this StreamYard link, it will redirect you to this screen, and we will be chatting together and support. This video is just about supporting Pamli vlogs, so that we may click the remaining hours. The last time I streamed for long, that is the hours that was remaining, 1,497. But now let me edit that. So because of the sake of my supporters, let me edit this and tell you now what hours am I remaining with, so that how many hours am I remaining with? Those are the hours. The last time I streamed for long, I was asking for those hours, but for now, I'm remaining with this particular hour, 554 hours to go. Yeah. So let me put it at flickering down there. So that is the hours that is remaining, the one that is tickering down there. I had 1,400 and something hours remaining, but today I am at 554. So meaning my videos, if you click all my videos in my playlist and you play all those videos today, running from tonight or right now as I speak, it means if you run them throughout the day, you will give me 24 hours. If I can have 10 people running tonight, it means by tomorrow I will be having 240 minutes. If I get another 10 people the following day, I will be having 480. So meaning that if I get 30 people who are willing to assist to run my playlist tonight, if I get 30 people running my playlist tonight, tomorrow I will be monetized, because I will be getting 240 hours daily for the next 3 days. That is 680, and I am done, because I'm having only 554 hours to go. So, ladies and gentlemen, my loyal subscribers, there is a playlist written all my videos. Kindly, if you have internet, wacha hiyo kitu icheze, so that we can click this 4,000 hours we are looking for, because each and every person, kitu yenye unafanya hapa duniani, I normally say is that you make money, you pray your God, and you wait to die. Now I'm doing this for money. I also pray God to help me as I wait for my death. So for you to assist me, you guys, the 4 guys who are watching me right away, in my videos, there's a playlist. There's a playlist written all my videos. Kindly click that playlist. Let it run throughout the night. Give me 10 hours at most. If 10 people give me 10 hours today, then I will be remaining with 400 hours tomorrow. That is after maybe 48 hours, it shall be been updated well. I'll be remaining with 400 hours. So the week that we are going to start, if those 10 people run my playlist at least Mondays and Fridays, then I will be having 400 hours plus the ones that plus those who are normally watching my videos. I will be having 500 hours by the end of next week. So my target is that I want this 554 hours to be half by mid-month, by mid of this month. By 15th, inafaa nikuwe at least 250 ama 210 ama 200 less hours. And hii siwezi fanya peke yangu, my guys. Hii siwezi fanya peke yangu. I must be with you people. So as I'm waiting for another guest, I'm just going to mute the mic, do some reset, break a bit, then come back. So keep watching, don't go away. Where is guest? Where is guest? Where is guest? Where is guest? I'm back. I'm back. I'm back. 2 hours, 34 minutes, and 59 seconds. We want to make it 6 hours so that you can beat this time. Subscribe to Family Vlogs. So, who is with me? Who wants to join 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 me here? Hmm? Nani anataka kunijoin? Who wants to join me? Who wants to join me? Who wants to join? Hello, hello, hello. Welcome to Pamli Vlogs. We are welcoming new members and also good. Thank you so much for those who have been watching this channel. Now 2 hours. And it's time for you now to start asking me some medical questions so that we can get the channel going. So, I'm ready. I'm ready and set. Okay. I'm ready and set. So, it is time to do this. Welcome to Family Vlogs and ask any medical quiz. And I will appreciate if you join me and start bombarding me with those questions. And I'll be very, very grateful. Let me test my audio. Testing, 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 1, 2. Testing, 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 1, 2. I think testing, testing, 1, 2. I think I'm very, very audible. The microphone is on and the volume is 100%. Yes. So, guys, I want to introduce you to some of the books that I normally read. There's Kenya Health Sector Gender-Based Violence Service Quality Assurance Tool. This one, even if it is for assessment, but it will give you a vast knowledge when you read this. If you are near Homa Bay and you can borrow this, this trainer's manual. It talks of very many things of let me just give you overview of what this book talks about. It's a very nice one. We were trained about gender-based violence, and this is forensic management, and this is for medics. So if you are a medic and you normally get cases to do with the court cases when somebody has been defiled or raped, kindly look for me. Look for me. I give you this particular book so that you read. There are very many things that are in this book. We define definition, terms and concepts, types of forensic evidence, which is very, very vital. Types of forensic evidence is very, very vital. And then how to collect evidence, how to document evidence. Okay. How to do physical and history checking all over this book, even how to present yourself in court. In court is very, very important. Some of us normally just see patients, but they have never stepped in the court of law. So someday, one time, you will be called to present a case. So when you want to present a case, kindly you can Google this online and you download a PDF of this. Use it in your daily case. Read it because it will really help you. This book is very, very important for medical officers, clinical officers, nursing officers, even community health volunteers. There are some part of that they should be presenting. and laboratory technologists, counselors. They form very vital role in terms of seeing the patients. So welcome back, and those who are with me online, ask family vlogs any medical question, and we will tackle it. Now we've been vlogging for the past 2 hours. I've been going on and off, but now I'm ready for you people to bombard me with questions just like the other time. And now I want you to ask queries, medical. Yes, type like this, enter. Yes, I've just sent something there. Ask queries, medical, and let me see in terms of comments. It's audible. Yeah, Mercy Shebi, thank you so much for joining. Let me pin you on the screen. Mercy Shebi, it's audible. I thank you so much for joining Pamli Vlogs. And it is now a time for you to ask questions and medically related questions. If I'm able to answer, I will answer you. If it needs a referral, I will refer you. So time is here. Thank you so much. Those who Asumbi TV was with me. It's going to play me Mwakazis also was with me, and also Sharifa Nakalema was with me, and also Akot TV was with me. So those are the guys that have been with me from the time I started this vlog, and now I'm continuing with uh, welcoming you all. Welcome to Family Vlogs, and it is time for asking medical questions. It's time for you to ask medical questions. So I do this to just wait for people who want to ask medical questions. And also, uh, if you want me to make a video on any condition, I normally give an explanation with a simple term that each and every person can understand. I don't want to use big medical terms that can scare you away. So ask me any question medically related, or if you want me to do a video, if you want me to do a video on a specific topic, kindly put that in the comment section, and I will be always here to answer. If you want to greet our members, click the StreamYard link that is provided there. I will see you as a guest, and I will invite you to the screen so that we continue with this particular discussion. I can see 9 people are online, 9 people are watching, meaning that the discussion wants to start. I know the Seventh-day Adventist Church members, you are from church, and now you are ready to be with me, and you are ready to talk to me, and you are ready to keep this channel going. So it's a time that you people can ask a question. I had discussed earlier on, Ochieng Bondo, colleague, let me pin you on the screen. Thank you so much, my dear colleague. I think you are locked. You can enter the screen and maybe present something. You might give us some of your expertise in this medical field. You can pick a topic and maybe discuss. There's a link on top of below this video written StreamYard. If you click it and you have good internet, it will bring you to the screen, and you can share your expertise. And also, you can click share. You can share this video to group members, and you invite them so that they come and start discussion with us. So my people, this is so good. Philip, welcome again. So it is a time to ask family vlogs, medical queries, and I'm very happy if you will be with me until the end of this live stream. And mostly we do this live stream up to 7, up to 7. Last time it was so nice. Very many people joined me, and we had very many discussions. And one of the question that was arising was ectopic pregnancy, and I had to go and make a video on ectopic pregnancy. So if you want to say something, or you want to appreciate what health workers have been doing, mostly during this time of COVID, you can join us well, and we'll really appreciate. Sorry, there is something that has created some echo here. So if you want to join us, internet normally go on and off, and we keep on going. So do not worry about that. And it's back, and it is back. So if you want to join Family Vlogs, kindly do not worry. That was a slight glitch of internet. It normally occurs when there's a power surge. So those who are locked in this, those who are watching me, asking you to ask any question before I start reviewing one of my video. Let me see which one do I want to review. Let me see which one I want to review. Mycotech, point taken. Oh, my friend, thank you so much. Oh, I hope you are running the playlist. Let me pin you on the screen so that you can also join us. There's a StreamYard link with your phone. Desktop sometimes do not have Do not have a camera, but with your phone you can greet us. You can just click that StreamYard link, and it will bring you back. And Mycotech, can you open for me some few tabs to keep the channel going? I will see you later. Keep the channel going. You can click Pamli Vlogs, Google Pamli Vlogs, and open some tabs so that, and maybe you mute volume so that we keep the discussion ahead, and we struggle with this wait time. So welcome again, and what I was doing is that ask some queries, ask Family Vlogs about any medical question that you need to ask, and I want to review one of my videos, and this my videos. I want to review something which is very, very important in this discussion. Let me see which video I can review. Okay, there are very many videos, factors links to twin pregnancy. Oh, my gorgeous link. Thank you so much for joining us. Let me just pin you to know that you are in, so that all YouTubers that have not connected with you, let them connect with Gorgeous Links. And I'm very happy. Let me change this type of, let me put block, yeah. Block is about minimal, can it, yes. The default is good, bringing you to a very big default, making you to be big in the screen. Magwaja's link, if anybody who is a YouTuber watching me, if you have not connected with Magwaja's link, kindly search her channel, look at any of her videos, kindly comment. If you are a YouTuber, she will comment back and subscribe to your channel, and that's how we normally do when we are live. If you are not a YouTuber, you can also check her channel by watching what she does in the YouTube. You can connect, Makojas, you can connect with Mercy, Apple TV, Asumbi TV. You can, those are YouTubers that have stayed in YouTube for long. You can click their links and watch a video, comment, and they can subscribe to your channel. So, Ask Family Vlogs Medical Quiz. I want to review a video, and this video that I want to review is has been having so many questions. I've been called by so many people through my phone about twin pregnancy, about twin pregnancy, about twin pregnancy. And if you have not watched that video about twin pregnancy, kindly watch that video. There's something that I want to correct, not even correct, to stress on, because even men are now interested. I said that genetical factors and inherited factors normally play a big role in twin, or in conceiving twin or getting twin, in the side of ladies, in the side of lady. If, for example, myself, I give birth to my wife give birth to a lady, and we have a family history of twin. Let me say a single pregnancy, and there's history of twins, and we have our firstborn who is a boy, secondborn is a lady. Now this lady will carry genetic uh, code of twin, and sometimes when she's married and twins arise, then we will verify, particularly fraternal twins. But if you get married to a man who was twin, maybe first twin or second twin, whichever, it doesn't guarantee that you will have twins. And I said that identical twins are always spontaneous. Anybody can have identical twins. Identical twins is not pegged for inheritance or even use of fertility drugs. So that thing you must keep in mind, that identical twins anybody can get. But fraternal twins, you can, there are some very many factors that are linked to fraternal twins that I talked about. And I talked about age, greater than 35. And you know, this age, you don't wait until you are 35 is when you give birth. My last video, I talked about ectopic pregnancy to be very prominent, high risk in those who are 35 and above. And also, in one of my videos, I also said that infertility is also very common in those who are 35 and above. So it is plus minus. You can have a family history of twins. You wait until you are 35 is when I'm talking about lady side, uh, female, not men. Men can give birth till, can sire child, can make a living to conceive till 70 years old. Weight also, I talked about weight, and I said that you should never be obese. You should never be obese. But weight, those who have BMI greater than 30 have high chances of giving birth to twins. Fertility drugs, I talked of clomiphene or clomid to be assisting in giving, helping to give birth to fraternal twins. And assisted technology, reproductive technology, ART, are also very, very important. This one, now you can make a decision when you go to fertility clinic. I want twins who are boys, or I want twins who are girls. They will do in vitro fertilization, and they know how to do in vitro fertilization until you get those your twins. So I also linked twins to a tribe in Nigeria called Yoruba, because of the yams they sell. They eat. There's a special yam that contain dietary estrogens. In fact, it was very nice to talk about Yoruba. Where did I write that thing? Diet rich in yams, Yoruba in Nigeria. It's a research that was carried in 2008. Phytoestrogen phytoestrogen or dietary estrogen that is found in this particular yam is responsible for hyperovulation, and two eggs can be released at a time, resulting into fraternal twins. So, monozygotic twins, talked about that's identical, mostly predisposing factors is unknown. Predisposing factors is unknown. Welcome, and you can even share with us. You can click the StreamYard link. Yes. So I've also talked about fertility drugs that I've talked about, clomiphene, and also the gonadotrophin drugs that I talked about, like Ovidrel, Follistim, and Gonal F and Levris. Those ones I talked in the video. I mentioned about Gonal F in that my particular video. Factors that are linked to twin pregnancies are there, and family history of twins. And remember, when you are carrying twins, you can even detect when the uterus is greater than the dates and you feel so heavy. But make sure you do ultrasound or pelvic scan to verify whether you are carrying twins or not. There are some disadvantage of having twins, particularly when you are going to give birth. When the first twin is breech presentation, maybe presenting with the head, presenting with the limbs, not the head, presenting with the limb or the back, it might result you into what we call cesarean section. So that is why in my videos, I said I'm reviewing videos. In my videos whereby I was talking about this particular book, I was talking about this particular book, the antenatal care. In this relation, I talked about season one of this particular book, and we talked about father support. Father support. Also, we went ahead and discussed about season 2, whereby we talked about importance of antenatal care. If at all you've not watched that video of importance of antenatal care, kindly, if you are a man, if you are a woman, and you've started courting, or you have been married and you do not have a child, kindly watch that importance of antenatal profile in that my video. And also I talked about season 3, I think it was preventive services, and there's also one I did live, and I talked about care during pregnancy. I talked about danger signs during pregnancy, and also I talked about human papilloma virus in terms of screening. And I promised you that I was going to bring a video on page 20 or 44, the test for VI and VILI, VI villi or VI villi, and the PAP, the Papa Nicolau test, that is the pap smear. Ladies normally know that. I went for pap smear. I went to a doctor to do pap smear. We normally rule out precancerous lesions or lesions that can lead to cancer, particularly when we are doing cervix screening, the VI villi. That VI is what we call visual inspection with acetic acid, and VI is visual inspection with Lugol iodine. So there's a way we expose your cervix using speculum, and we visualize it with the acetic acid and Lugol's iodine. And there is a way we are trained when we look at specific conditions in that your cervix, we may say it might be linked to cancer of the cervix, and then we refer you for further management, especially when we get low-grade squamous intraepithelial lesions and high-grade squamous intraepithelial lesion when we are doing that. Also, we can send you to cryotherapy and even do what we call loop electrosurgical excision procedure when there is anything that is present in when we suspect this now when we are doing breast lump examination. Now, examination of your breast is also very, very important, and I will discuss this in a specific video that we do with how to examine a female breast. So clinical breast examination is very, very important to each and every female. Please, there are some that, especially when you feel a breast lump in your breast, or when your breast is discharging either a clear fluid or a green fluid, or discharging even blood. Blood is now pathognomonic, is diagnostic of cancer of the cervix, of the, sorry, cancer of the breast, uh, cancer of the breast. So, let me reply something. So sometimes somebody can ask, why is my breast discharging fluid? Why is, like yesterday, I had a client who asked me, my breast is discharging whitish discharge, but not resembling milk. We went through the charts, and the patient was very worried. This might be cancer. She was a lady of 19 years. She was very worried because she had consulted some friends, and some friends told her that, now, my friend, you have breast cancer. Anza kujipanga. I didn't like the advice from the friends, and that's why we normally encourage that if you are sick, particularly any type of sickness, being a lady, being a man, if you see something extraordinary in your body that you need to consult, please don't consult a non-medic. They will give you myths. They will tell you, one, in fact, the myths that I normally get in the hospital, that go take a cooking stick and point at that your breast, and that problem will go away. There is no way breast lump will go away, or there is no way discharge will go away. Sometimes discharge is normal due to hormonal imbalance, particularly the white one, the whitish one, but also it can be a problem due to prolactinoma, the pituitary gland tumor. We need to investigate. We normally prescribe cabergoline, or even clomiphene for those who are expressing, those who are not breastfeeding, but they have discharge of milk from their breast. Or if you are breastfeeding and maybe your child has passed away and your breast is engorged with milk, or you do not want to breastfeed at all, we give you that drug. We give you that drug, and it normally helps to clear the fluids away, the breast milk. So I want you people to be encouraging mothers to come to the hospital for this. But this book, the reason why I did the series is that a woman comes to the hospital with this book. Well, yes, we don't, we love that. She does have Linda Mama. And I told you that Linda Mama is very, very vital in terms of taking care of your pregnancy when you are sick, or when there is a complication up to 3 months post-delivery. And it's free. Some normally wait until they're in labor. They have never attended any clinic, even once. Sometimes the first they went to a periphery. Peripheries do not normally do what we call antenatal profile. The best they can do in the periphery is maybe checking your HIV status. So you get that this book, only in the part of antenatal profile, if you have this book, page 7 or 44, they have only done malarial test and HIV. Then they have referred, please go to our next hospital, and they normally write. But our mothers, when they come, I was not told anything to go. I was not, then they keep on lying. Because there is no trained nurse, there is no trained clinician in this world that can only insert your blood slide for malaria parasite and HIV status only, minus informing you that you need to do your blood group, you need to do your hemoglobin level, you need to check your rhesus factor, you need to do your analysis to rule out anything. You need to do very many investigations as per you are presenting at that particular time. Because antenatal profile only is not pegged to a woman when she comes to the hospital. She might come with a different condition, having signs and symptoms depicting typhoid fever, depicting preeclampsia or eclampsia, that is hypertension in pregnancy. We must do other tests like urea, electrolyte, and creatinine levels, check how kidneys are functioning. So, my people, kindly let our mothers, and if you are a man listening to me, because when a man comes with the wife, we ask, have you read this book? And when I was introducing this book, I said that this book is not for you alone. This book is for your son and your daughter when she or he will be 18 years of age. And I want to repeat what the Ministry of Health is saying for the sake of this video. Now, congratulations on this pregnancy. Ministry of Health would like to celebrate with you and present this mother and child health MCH handbook to you. Please read well together with your family members. Understand the content well. It is not for you alone. You read well with your family. Sometimes you don't know how to read, but let your son or your daughter or anybody to explain to you well. Now, carry this booklet every time you visit health facility and show it to the health worker. Some normally come when they do not have this book. So when you do not have this antenatal care book, how will we know that you have a very bad underlying condition that need to be taken care of to save your child right now that now you are in labor? And the ministry also goes ahead and say the MCH handbook will be used during pregnancy, that is one, childbirth, and after childbirth until the child is 5 years old. 5 years old. As soon as the child is as soon as the child has received the 9 month measles vaccine. Yeah, I think so. That is the last one. With even weight monitoring until weight and height monitoring until in terms of nutrition until the child will be 7 years. You are not doing that. So, what again will we say in this? Please keep the book safe. Keep the book safe. Let me answer. Let's go. I'm live. I'm live, please. Yeah. Keep the book safe. Keep the book safe and hand it over to the child when she grows up to an adult as a present with instruction to keep it safe. So this book is not for you alone. This book is for not for you alone. You should be handing over this book to your child when he's 8 years, when he's an adult. And the reason why you should be handing over is just appreciate what you as a parent or what you as a mother or as a father you are doing to this particular child when the child was very young, and also to appreciate the work of health workers, what they were doing when you were young in terms of what treatment they were giving, what not did they write, what problems did you have during those particular days. So it is very, very vital to hand over this book. Personally, my parents didn't hand over this book to me, maybe because one, it's a new version. The older version did not have that particular line, particular advice from the Ministry of Health. And yes, I think that is the main issue, and maybe it got lost. So this book is very, very important. This one I was given to help the society in terms of teaching. So if you are watching me right now and if you want to join me and ask me any question, kindly click the StreamYard link that is available below this video, there's a StreamYard link. If you click it, I will see you as a guest and I will add you to the screen. I do not have a guest, yes. I do not have a guest yet. So if you are a guest, if you want to be a guest in Family Vlogs, as we continue reviewing my videos and as I wait for any question to be thrown by any member, Last time questions were coming and Akos TV was really contributing well. And I want you people also to follow her footsteps and maybe ask any question that you may be willing to ask. I think I will still continue with season six of this book. Remember, I promised that I will discuss this particular book until I clear it. And what is normally worrying the preemies, those who normally give birth at the first time, is a problem called breast engorgement. And if this engorgement continue for a long time, it normally brings an infection called mastitis, inflammation of the breast because of poor positioning for breast and poor attachment to the breast. This is what I'm talking about. This part. This is part I'm talking about. Let me bring it like this. That's attachment to the breast and positioning of the child. I talked about this in my previous video on how to position your child and how to attach your child to the breast milk and the factors that we consider when we attach the child into the breast. So our ladies, when you are pregnant, kindly move to page 16 or 44 and read that particular book. When you are pregnant and you are waiting to start antenatal care, what are you waiting for? This book is given free. Linda Mama is given free. The drugs that you are taking, the preventive services, is given free. Net, you are given for free. What are you waiting for until the time you are in labor? Is when we realize that you had a breech presentation, we realize that the child had died intrauterine, what we call IUFD, intrauterine fetal demise. And I said earlier that please, when you are pregnant, don't just take drugs. Usimeze tu dawa. Don't just take drugs for the sake of taking drugs. Kindly consult a medic for a proper prescription. Or if you go and buy over-the-counter medicines, kindly note the chemist who is dispensing for you the drugs that I am pregnant and I am pregnant with a child of this month, because there are drugs that we cannot use in the first 3 months. There are drugs we cannot use in the second trimester, that is from 3 months, 4 months, 5 months, 6 months. And there are drugs that we cannot use in the third trimester. And there are drugs that we cannot use at all. Those are cytotoxic drugs, that the one I talked of yesterday, the other day, ectopic pregnancy, the methotrexate that we normally give when a woman has an ectopic pregnancy which has not ruptured. So do not just take drugs. And if you come to the hospital, kindly inform us that I've conceived. And hey gamer, thank you so much. This is my lovely friend from India. I like your channel. My son liked your channel because of that. The games, I normally give him time to watch. Yes, thank you so much, Gema and Suhaib. Suhenri Gatungo, welcome to Pamli Vlogs, and I was giving advice concerning this book, and also, as the topic says today, ask me any question, any medical question, and I will be here for you to answer. Welcome, a gamer, and welcome those who have joined me. And kindly throw any question before you leave. If you are in a place that there is internet, you can leave it to play in the background. And as you do your things, as you do your cleaning in the house, you can listen to what I'm advising people via this channel. And you can also ask any question that you need me to tackle. I've done very many videos. I did human papilloma virus, second last video. I did ectopic pregnancy. I did blighted ovum. I did the do's and don'ts when you are raped, dysmenorrhea that is painful mental. I also did even ovarian cyst. So I have very many videos. Some even I can't remember unless I go back to YouTube. But those are very, very important topics that I have done, unless I check this my book where I wrote the topics that I've tackled in YouTube. So I want you to throw any question medically related. If you want to greet us, click the link written StreamYard so that we can promote your channel. Gatungo, Egema, Makboja's link, kindly connect to one another. Those are 3 subscribers you people have. Kindly search Efo Egema, is a friend from India, and subscribe to his channel. And also connect with Makboja's links, and subscribe to our channel and leave a constructive comment so that he will come back and subscribe to your channel also. And we did have a Code TV. Let me just put them before I go to another video. Sorry for that. That's Gatung. Subscribe to that. Also, this is F4 Gamer. This is Makboja's link. Subscribe to their channel. I don't know whether Masi Shebi has a channel, but kindly check. Sumbi TV is a close friend. Check the channel. Mwakazi does fitness. You can, if you have a problem of sternocleidomastoid, you just do some fitness. That is Mwakazi. Sharifa Nakalema, she's in USA, very supportive lady, very serious with YouTube issues. Kindly subscribe to her channel. And also Akko TV. I love this lady. She's also from this our country. Check her channel and subscribe to her channel. And which one again? Yeah. So those are the ones, the YouTubers that have visited me today. And the last one is now you. Kindly subscribe to each and everyone's channel so that things can go well. Now, Ask Pamli, those are my YouTubers, and I must show them people so that you, all my watchers, kindly look at those channels. They have very many. Nice topics. If you want comedy, if you are a Luo, go to Asumbi TV. You will laugh. You will laugh. You will laugh. You will laugh. So I was checking my videos, and I've gotten somewhere I wrote them. These ones I did in December 14th to 31st, and I talked about sildenafil citrate. That is on 14th. I uploaded sildenafil citrate. That is Viagra. Yes, I have a guest. Mark Gorgeous link. Let me add you to the stream. And hello, how are you?
Hi, doctor.
I'm okay. Let me remove
Okay,
this.
how are you?
Hello, how are you? Mark Gorgeous Lanes. Are you
Are you
getting
able to
me?
hear me?
Oh yes, I'm hearing you loud and clear.
Yes, I can hear you too.
Okay. So let me
Forgive me,
just
I'm in the kitchen, so I can't show my face, but I have a very important question to ask.
yeah, yeah. Okay. I've pinned your channel into the screen now. Can you say something, or if you have a question, you can ask, or you can just greet us, greet the community.
Okay, hi guys. I
Okay.
go by the name of MC Gorgeous Lins. I am a people and blogs kind of person. I create vlogs that I love. I interview African talent. So if you don't mind, you can check me out. And also, I do have a medical question to ask the doctor right here because I follow your content so much. So
Okay.
I have a question about ovarian cysts. I saw your
Okay.
video, but I quite didn't understand the types and which one could be cancerous or not.
Okay.
Yeah.
Okay. So you wanted us to talk about ovarian cyst.
Yeah, I want you to explain it one more time.
Specifically, what
The types.
the types of ovarian cyst.
Yes.
Okay, okay, okay. So have you watched that my video to do with ovarian cyst?
Yes, I
Hello?
did, but there was a point where I didn't get it, so I need a repetition.
Okay. So which points did you understand so that we can gauge and talk about it into details?
Well, I understood that there are types which can be cancerous and types which can be benign and non-cancerous, but I couldn't differentiate the ones you were telling me that are cancerous or not.
Okay, okay. The malignant one. Of
Yes.
malignancy, the malignant one means these are the ones that can cause cancer. Okay, of course, in classification, I started by saying that we have functional and non-functional cysts. Okay, and I said that functional cysts are happening when the normal menstrual cycle, they normally follow the normal menstrual cycle, and I talked about two of them. I talked about what we call follicular cyst. Now, I started by saying that when hypothalamus is sensitized, there are two hormones that are being released from the anterior pituitary gland, that is luteinizing hormone and follicular stimulating hormones that normally work in the ovaries, and they target the follicles in the ovaries to develop and mature. And when there is ovulation, then there's a remnant that will be left that is called corpus luteum. Now, how do they arise, the cyst? The first one, the follicles that I'm talking about, will sometimes grow and become what we call follicular cyst. And this is normal. With time, it normally regress and doesn't cause any problem. And when the follicle releases the egg, the remnant of that we call corpus luteum, and it will form what we call corpus luteal cyst. And this one also is normal in women. The only problem is that if they grew 3 centimeters, they normally cause some mild pain, but they regress on their own without any treatment. Now, the ones that are bringing problems are the ones we call non-functional cysts, and we talk of polycystic ovarian syndrome or polycystic ovarian cyst. Poly means many. Cysts are too much. There are very many in your ovaries, and they cause problem, especially the right and the left flanks. You feel pain, and sometimes it can be referred to the lower abdomen. And also I talked about endometrial cyst, the one we call chocolate cyst. This is brought about because of the inflammation of the endometrium. We know it endometriosis. So this problem can this chocolate cyst also can bring low abdominal pain, all signs and symptoms depicting of even urinary tract infection, but they are not. We normally do this by ultrasound. I also talked about dermoid cysts. Dermoid cysts, I talked about, they contain hair, bones, tissues, and there. Now, the ones that now you are referring to, we are calling them functional cysts, but they, because of the time they normally take to regress, their cells can turn into cancerous. Now we call this one malignant tumors. And we have ovarian serous cystadenoma, which will even grow and become cancerous, and then we can call it cyst adenocarcinoma. Now, adenomas are benign, they are not cancerous, but carcinomas are cancerous, which means they are causing cancer. And we also talked about teratoma, malignant teratoma, which is also cancerous. We also talked about mucinous cyst adenoma, which is also cancerous. So in that video, I didn't talk about ovarian cancer per se, but I mentioned ovarian cysts that can grow and turn into ovarian cancer. Are we together? Magodias, are we
Yes.
together? Yes. So for us to know this, we will do series of tests to verify whether these ones are functional or non-functional or even ovarian cancers. And we have tests called tumor markers that we normally do your blood and check. When this ovarian cyst grows big and we are suspecting cancer, of course, we'll take you to surgery and we'll take a chunk of meat in that particular cyst that have grown for histology. Histology will give us the grading of this. It will tell us, no, this is just a normal ovarian cyst that has not become cancerous, or this is an ovarian cyst which has now become cancerous, and this is the stage. And management treatment will depend on whether this is stage 1, stage 2, or stage. Mostly cancers, all cancers, when you detect them early in stage 1, you can treat and manage. But when now it is stage 2, 3, 4 going onwards, sometimes even if we put you on chemotherapy or radiotherapy, sometimes management can be very, very tough. And smaller percentage normally turn cancerous. Mostly ovarian cysts do not grow to form cancers, but smaller percentage, 2%, 3% normally end up being ovarian cancer. In my practice now, started practicing in 2009 up to today, I've not met any. I've only met ovarian cysts. And mostly if we send them for investigation, they turn not to be cancerous. So we just, no management of ovarian cysts is watch and wait and give some drugs. So we normally watch them, give some drugs, they come back until they will regress. If it continue to grow, the signs and symptoms that will tell you this ovarian cyst is now growing is that this month we saw you, we gave you time to come, you had some mild abdominal pain or some interference with your menses, maybe sometimes heavy, sometimes light, sometimes you miss, but you are not pregnant. But now you are coming again, we are getting that the pain is increasing and menses is becoming heavy, and you sometimes you may become anemic. So we may advise you to go for surgery so that we can remove this. Of course, at that surgery, we'll take that cyst and take for histology to rule out that it is not what, it's not cancerous. Are we together? My gorgeous, are we together?
Yes, we are. So I was actually diagnosed with an ovarian cyst. Was it late last month, around September? The thing
Oh,
is, I went for a scan. I think it's an ultrasound or whatever, one of those scans. Then the doctor is like, it's still small in size and whatnot. But I keep on wondering, why do I get such sharp pain only in the middle of the night, around from midnight and above? It doesn't come during the
Okay.
daytime, it only attacks me when I'm sleeping. Why would that happen?
Okay. Good. Most diseases, let me say those who are having sickle cell, those who are having cancers, those who are having heart diseases, problems normally occur during the night. During the day, you are so busy with your daily course and your mind is not pegged to that particular place. So when you are resting, now your body, your brain is now detecting that there's a specific problem going on, which during the daytime, your body in terms of detecting pain was not very, very easy because you move a lot, you do a lot of things, you put your body into work, your metabolic rate is increasing. But during the night, everything is a standstill. And that's why most of the diseases today, you feel nice in the daytime, at night, you feel a lot of pain. Now, it is because of that strenuous day you normally have. The pain comes as a result of now the body is at rest and the brain is detecting that particular area and it is concentrating in that particular. That's why you feel that pain. Otherwise, a sharp pain due to that, we normally recommend a good painkillers that you normally do. And if at all the ovary or the cyst is giving you stress that you cannot do anything, we can opt for removal, even if it is small. And this one we do as per the patient request. When it is giving you psychological trauma, you cannot do your things, however small it is, we can opt to do surgery. But we normally inform you that this particular size, we do watch and wait. Of course, you can be initiated on some drugs that you may use over a period of time just to suppress the growth. I hope you are initiated on those particular drugs, particularly the birth control pills, the combined oral contraceptives. You can give all, or you can be given the one you normally buy in shops or the one containing progesterone only, just to regulate your hormonal balance in your system. Otherwise, there is no specific drug that now is indicated for. This is now for ovarian cyst. It's just to maintain and control your uh, ovulation, because frequent ovulation will mean frequent maturation and development of new follicles, and this one might also contribute to interference with the current cyst that is in place. Sawa sawa, are
Sawa,
we together?
doctor. Thank you so much.
Okay, karibu ndani, karibu sana. Any more question?
So, no, not for
Any?
now. Let me just finish cooking, and maybe if you're on later on, I'll find you again.
Okay, thank you so much. That was Gorgeous Link, and she has said something very, very serious. And this problem normally affects ladies, and it's due to ovarian cysts. And I had made a video to do with ovarian cysts, and I talked of very many things there. Sometimes we might fail to explain things in the normal layman's language, because now things like cystoadenoma, mucinous adenocarcinoma, malignant teratoma, clear cell carcinoma, there's no specific English that I may use to describe the those type of cancers, but I can use a layman's language that those four things that I've mentioned, those are cancers of ovary, or we call them ovarian cancers. those terms like cystoadenoma, malignant teratoma, those are for pathologists. So don't stress yourself with that. I have a guest. Philip is inside. Oh, why am I not able to invite you, my dear friend? Though your camera is off, but if I'm clicking invite, okay, why am I not able to edit, click, ban? Oh, can you check? Are you using a desktop, my friend? Kindly comment so that I can know. If you are using a desktop, you cannot be able to join me. If you are using a laptop, you will, because laptop has voice, has a microphone, and has a camera. But okay, there is one message here. Okay, left, but here we is okay. 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 This is private. Using a phone. Oh, okay. Kindly retry it again. Kindly limit it. Oh, okay. I'm going to remove you and try it. I'm going to remove you. I'm going to kick you out. Okay. You try again. I've been trying. You know, the last guest, and it was so nice. She had a question of assist. Kindly try it again. Make sure that when you are entering StreamYard, enable your microphone and enable your. Oh, it is coming the same. Okay, it's okay. You. Really, why am I not able to add you? I don't know why I can't add the screen. Can you refresh that you are click that icon on the URL part, refresh it and try to come in. This is now the second time this thing is happening to you, my friend. I'm sorry. I'm trying to invite you to the screen, and the screen is not allowing you, and it should be allowing you. Is there any restriction, or is that your phone not? If you're using your phone, then it's good. You should be able to join us as a guest. So we were talking about ovarian cyst, and that our guest has talked about having ovarian cyst, but it's still small in size. We cannot go ahead and remove that only if the ovarian cyst is giving you stress. And note that non-functional cysts are always going away with menses. And I've said that we have follicular cyst and corpus luteal cyst. Let me try again to add you back. Ban from studio, edit, kick from studio. My friend, why is it? Why? Or I change the name. Let me give you Bob. Let me give you a name, Bob, if it can enter. Oh, you went away. I don't know why it's not. It's not. Can you use? Oh, kindly use Chrome. Use Chrome. Use Chrome, my friend. I've even tried to. I've even tried to your name so that I've given you a name called Bob, and it's not entering. Kindly use Chrome. If you are using Opera Mini or Mozilla Firefox or any other browser, sometimes it's very hard to work with StreamYard. So kindly try using Chrome so that we see. Hey, my friend, this thing is. As you need. Mm. I don't know why this thing is not making you not to join me. I can't explain because most people normally come and just click and that icon that when you are using StreamYard, if comes, it appears in your guest column, and whether the guest has muted the camera or not. Okay, thank you so much. I wanted to invite you, but itu sasa imejam, you know, technology sometimes. But you can continue trying. Just I will invite you. So we were talking about ovarian cyst, and I said that for functional cyst, that is follicular cyst, luteal cyst, or even the thicker luteal cyst, this normally goes with menses. But non-functional, like chocolate cyst, that endometrial cyst, polycystic ovarian syndrome or polycystic ovarian disease, dermoid cyst. I've talked about ovarian serous cystadenoma. This now is live for pathologists. Ovarian mucinous cystadenoma, cystic adenofibroma. These are very rare, but the ones that are normally occurring, almost 80% are ovarian cyst that we call polycystic ovarian cyst, or a disease called polycystic ovarian syndrome. And also we have endometriosis, that one we talked about, and dermoid cyst we talked about. So symptoms discussed earlier, and diagnosis majorly, if you come to this our facility, the only thing we'll do is physical history, history and examination, and we'll do to you ultrasound, and also we'll rule out that you are pregnant or not. So even the main goal, if you read obstetrics, Williams' textbook of obstetric and gyne, and obstetrics by 10 teachers, there's a part they say it is watch and wait approach. You watch and wait. You don't just do surgery, except that cysts that are greater than 5 centimeters by 4 centimeters by 3 centimeters. Those are bigger ones. You normally do surgery. And we said in our video that there are cysts big as this. Which one can I compare? You know the 20 liters kibuyu, 20 liters jerry can, a big cyst weighing almost 50 kgs have been removed. You can Google that about how big a cyst has been removed from a woman. You will get that what I'm talking about is really true. Now, where is another person with another question so that we can keep discussion going? Which one again can? Yes, let's talk about dyspareunia, that is painful sex. This is a question that I received this morning via call, and I told that patient that if he's near Homa Bay town, he should be able to see me. And she came in the morning, and we were able to say one or two, and we were able to assist where necessary. Now, dyspareunia is pain while having sex. I made a video on this. I'm just repeating on what I did. And I started by saying that dyspareunia, pain during sex, it can be on the vaginal area or deeper into the pelvis. And if you are experiencing this, kindly, there are factors that can make a lady to feel pain while having sex. And I talked about this in my video. I'm just going to repeat. We talked about pelvic inflammatory diseases. The commonly common one are chlamydia and gonorrhea. You should be able to get screened when you come to the facility if we are suspecting that this your sexual life it's not enjoyable to you because of this STIs. Even urinary tract infections can cause pain while having sex. So screening individuals or screening both men and women when they come to the hospital is very, very key. I talked about vaginismus, condition where the muscles around the vagina shut oh, welcome, my friend. We are talking good stuff. If you want to join us on the screen, you can do that. I think you are from India. I think you are from India. Akash. Oh, yes, Akash. For Egem. Welcome to Pamli Vlogs again. We are still discussing good stuffs, and through this discussion, through you are coming to this channel. What is your watch time, my friend? Where have you reached? Let me tell you where I've reached. The one tickering down there. Uh, those are the hours that I'm remaining with. So that I meet the terms and conditions verified by YouTube to be their partners. You know, for you to be a YouTuber, let me network is bringing problems. If you want to be a YouTuber, oh, network. Okay, it's back. Okay, network sometimes you may be network sometimes normally disturbs. So if you want to be a good YouTuber, first of all, if you want to make it in YouTube, uh, you must have 1,000 subscribers and above. That one had passed long time ago. I think my community is growing very slowly, and I don't blame myself because many people do fear subscribing to one's channel. They just watch, and those who normally watch my videos are those who are not subscribed. Subscribers are few. Bigger percentage of those who watch my videos are those who have not subscribed. So I've met one condition that you must have 1,000 subscribers. I've done that. My community is around 2.5 something subscribers, and you must have 4,000 watch time within a period of 365 days. I've clicked that. As you can see, there's some ticker, 554 hours to go. That is the hours I need so that I be accepted by YouTube partner program, so that even if I post videos, my videos can be recommended to very many people. For now, even if I post, I get few watchers, around 100, 200 per video. They are not so much. But if at all I click these hours that are remaining and I'll be accepted in YouTube partner program, then I'm very positive that my videos will go viral. Okay, there are some people who make videos, the comedian, their videos go viral. I play one video, go viral. Yes, so if my video will go viral, that one I will reach that time very fast. But for young YouTubers who have less than 5,000 subscribers, we normally like going live to get more people, to get more views, to get more hours. And that is the main reasons why we do this. As part of teachings that I normally give via YouTube, I would like you people to share this, and the 9 people that are watching me now, I kindly share this my video, or if you can't share this, you can share any video. And if you want to contribute, if you want to greet us, here, whether you are in India, you are in Pakistan, click that StreamYard link and speak English. Yeah, the little English you know is what we'll use. English is not our it's not our mother tongue. We are just trying. It's something that came with an aeroplane, and we normally use it in terms of vlogging. So welcome Okash, that is Akash, and is a friend of mine from India. He's a gamer. He's also doing some good things in terms of gaming. And if you are watching this video and you want to know how to do gaming online, kindly comment, give a constructive comment to A4A Gamers channel, and he will subscribe to your channel and he will follow you. And any questions that you would like to ask in terms of gaming, you can ask and you will be helped there. So still welcome to Family Vlogs, and we are still doing this our thing like Ask Family Vlogs medical quiz. So I was talking about the video I did about pain while having sex, and I've talked about infection, I've talked about vaginismus, the muscles are very tight, and this one can be due to psychological trauma. Somebody had been raped, somebody had been defiled, she fears having sex, and now the muscle shuts down. And when you are trying to go inside with your penis or even your normal hand, you cannot go because of this vaginismus. Some people normally use, they do dutching. Dutching is introducing something into your vagina, like you buy Dutches in the shops, to do something, use some soaps, liquids to wash and make their vagina clean. Ideally, medically, dutching is not wanted. The reason why you don't want dutching because you are interfering with the normal flora of your vagina, and you are interfering with the normal pH of your vagina. And I normally talk about this. If pH is altered in your vagina, what will happen? The normal floras will start growing, and one of the normal flora is just candida. Candidiasis do not affect you when your vagina is okay, when the pH is normal. Lactobacillus is there, resting, there's no problem. eh? But when you dodge your vagina, you will interfere with the pH, and you will start having this particular discharge, thick discharge, or even light whitish discharge depicting of bacterial vaginosis. You will have what we call vaginal candidiasis caused by this fungal infection, not bacteria. The fungal infection called Candida albicans. Menopause is also very vital. The change of estrogen, progesterone when you are getting old, they normally go down, and they are responsible for lubricating your vagina, making you feel a woman. When you are growing old, you can have that pain. Some people do not even prepare their women. Lack of preparedness, lack of sexual arousal to this particular women. A woman need to be told prior, even 3-4 days prior, that today I'm going for kunyandua. Naenda kunyandua mbaya nguvu. I'm going to do it. Yes. I'm going to have bring some signs that you want sex if you are a man. It will help the lady to be prepared psychologically. The vagina will be lubricated. Now, when you are entering with your penis, then things are good. The woman doesn't feel pain. But when you are a type of, my friend, can you lie in that bed and open the server? I want to access the internet. And you go do your things. You leave your woman when she's hanging, she's in pain, friction has killed her. So it's very, very vital to think about that. Vulvodynia, this is a vulvodynia. Vulvodynia is chronic pain that is affecting the vulva. And sometimes you might feel it even when you are topical analgesics give you to apply on your vulva, and watch and wait. So that is it. So deeper into the pelvis, there are things like endometriosis affecting the endometrium, cervical polyps affecting the cervix, uterine fibroids affecting the uterus, irritable bowel syndrome, and even constipation. Those are things that can make a woman to feel pain deeper in the cervix. So what do you do? when you have this kind of problem. You do Kegels. I'm sitting down, I cannot be able to do Kegels exercise. But Kegels exercise even help men to maintain their libido. Okay, these muscles in your penis or in your vagina that you use to stop urine. When you are urinating, let's say you went to urinate somewhere that you are not supposed to urinate there, then somebody comes and automatically you stop that urine. Poop, that muscle that you use to stop that urination, you make use of it during Kegels exercise. I think I should make a video on how to do Kegels so that we can help the facility. And then we have what we call concept object that you normally insert in your vagina to make your vagina dilate, and even the use of the finger. If you are a lady, your finger, not a man's finger, you insert it slowly, slowly, slowly until this is particularly when you have vaginismus. You insert it slowly, 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 slowly until the vagina will now be ready for sex. Of course, you can go for sex lessons, sex counseling. They will tell you how to use the vaginal dilators, the one I've talked about, the concept one that you insert in your vagina. Everything will be okay. So that is it. So guys, I want to go and buy some fluids. You know, if you are talking like this, you can talk for 8 hours. Now, keep me running background, please. I'm going to buy some, let me say, something that can give me a little sugar, maybe a little sugar to keep me going. You know, I'm remaining with 3 more hours. I normally vlog for 5 to 6 hours on either Sunday or Saturday. So stay tuned and do not go away. I'm just going to mute this camera. I mean, no, I'm going to mute the mic so that you don't get background noise. But I'm coming back, so don't go. I have 6 people watching. I would like to get these 6 people when I'm back. Every teachings needs a break. It is 5 o'clock, and let me go buy something. I am back. I am back. I am back. Well. I am back. And I am back to do serious business for the next 1 hour. For the next 1 hour. I'm back to do some serious business for the next 1 hour. Testing, 1, 2. Testing, 1, 2. This one I placed here so that I can talk to those who are online. Now that there's no guest, we can continue. Welcome to Pamli Vlogs, and we want to continue with what we are doing. Check whether I have a guest, no guest. Any comment that was, any comment? 5 online. Thank you so much for those who have waited for me when I went to have some lunch, some supper, and it's very vital for you to continue assisting Pamli Vlogs. Okay, let me test the volume. Just introduce something here. Okay. Hello. Hello, 1, 2. Okay, let me test the volume. Okay, volume is okay. Now we can see, you can yes. So I have series of videos that I'm going to do in this month, and in this month I've only posted one video, that is human papillomavirus and ectopic pregnancy. In my list to come, I don't want to give you a leakage, but I have 18 out of 18 videos this month. I've made 2. It means I'm remaining with 16 videos to go, so that this month is done. And this month, remember, this month is my monetization month. So if you want to assist Pamli Vlogs in terms of making him to be accepted by YouTube Partner Program, and that is the prayer for any YouTuber, kindly watch this video until we will clear vlog. And also, if you want to support us by doing vlogging, you may assist us by sharing this particular video, by talking to us, and asking any question medically, so that this channel, we can continue vlogging. As I can see, you are online, and 6 of you are watching me, and I would like you to ask any medical question, and you will be blessed. So as I've told you earlier, it is what we call road to 4,000 hours watch time, and in this we have clicked 454 hours, and we are remaining with no, we have clicked to 3,446 hours, and we are remaining with 554 to reach 4,000 hours watch time. Let me hear what this my colleague is saying, so that I'm muting the mic. Thank you guys for waiting for me. Oh. 4 hours, 20 minutes. I need to end this. Oh, Esther Chronicles TV, thank you so much for joining. And you are joining, and it's when we are clearing the vlogs. So thank you so much for everybody who have been with me since the beginning of this video. And this one was Road to 4,000 hours. It was not a silent vlog, but we were contributing in terms of a medical discussion. And I like the way you people have assisted me in terms of joining me live and supporting my channel in terms of watching. And I'm very happy to be with you from the beginning of this live stream up to now. So we've clicked 4 hours and 21 seconds, and I now feel dehydrated. I should pack my stuff and go. I should pack my stuff and go. The house is getting late. It is around 5, 17, 21 hours. I wanted it to go for 6 hours, but now anybody who is here watching me, there are some 6 guys still watching. I will still be with you, and I would like to appreciate what you've been doing to me today in terms of watching my videos, in terms of being with me in this live video from the time I started. Now it is 4 hours, 22 minutes without a break. I just went a bit to take some cold shower and I'm back. Those who have been supporting this my channel, thank you so much for what you've been doing. And those who have been sharing my videos, commenting on my videos, wanting me to reach 4,000 watch hours, I'm very much grateful. Those who have been supporting me in terms of finance, I'm very thankful and I'm very grateful. I'm going to end this stream now, and appreciative for all what you people are doing. So thank you so much, and may God bless this day. Kindly, if you have not subscribed to this channel, hit the red button, written subscribe, turn on the bell for more videos that we post. Otherwise, muchas gracias. Ending it now.